Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. In this episode, join us for a discussion on addressing abuse in long-term care facilities with Dr. Laura Mosqueda, a professor of Family Medicine and Geriatrics, and Beverley Laubert, the National Ombudsman Program Coordinator at the Administration for Community Living.
Hello, I'm Lori Smetanka, the Executive Director of the Consumer Voice, and welcome to today's episode of Pursuing Quality Long-Term Care. Today, we're talking about abuse of those living in long-term care facilities. It's an issue that affects thousands of residents of nursing homes, assisted living facilities, and other long-term care settings every year. Abuse is defined in federal regulations as the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, or mental anguish. It can take many forms, including physical abuse, verbal, sexual, mental, emotional, and financial abuse. And despite the fact that federal law states that residents of long-term care facilities have the right to be free from abuse, it still does occur and is largely underreported and inadequately investigated and addressed. Recent data are indicating an increased concern about incidences of abuse in long-term care facilities. And that, along with the fact that June 15th, which is right around the corner for us as we're recording this, is designated as World Elder Abuse Awareness Day, made us think it was important and timely to talk about this topic. So joining us for today's discussion are two of my very favorite people. Dr. Laura Mosqueda is a professor of family medicine and geriatrics at the Keck School of Medicine at the University of Southern California. Dr. Mosqueda is a clinician, researcher, educator, and is widely respected authority on elder abuse and care of the elderly and underserved. She's held several roles at the Keck School of Medicine, including as dean, and she is the director of the National Center on Elder Abuse, of which Consumer Voice is a partner. She also serves as a volunteer long-term care ombudsman. And also joining us is Beverley Laubert, who is the National Ombudsman Program Coordinator at the Federal Administration for Community Living. Beverley served as an ombudsman in Ohio for 33 years, including 26 years as the state long-term care ombudsman. She spent a year in the governor's cabinet as the director of the Ohio Department of Aging. And Beverley was one of 25 members selected to serve on the National Coronavirus Commission for Safety and Quality in Nursing Homes, which I was also a member of and served with her on, and provided input to the recently released report from the National Academies of Science, Engineering, and Medicine called the National Imperative to Improve Nursing Home Quality. So thank you both for joining me today on this to discuss this important topic.
Thank you, Lori. And I have to say thank you for all of the support that the Consumer Voice gives to ombudsman programs nationwide. As a host for the National Ombudsman Resource Center, you do great work in empowering families and residents, and I'm thrilled to be with you today.
Thank you. Glad to have both of you with us, and the ombudsmen are also some of my favorite people, so particularly delighted to talk to both of you. So as I mentioned a minute ago, June 15th is designated as World Elder Abuse Awareness Day. And Dr. Mosqueda, maybe you can start us off by telling us a little bit about what that is and why it's important that we focus on elder abuse.
Yeah, I'm happy to. Thanks for inviting me to participate in this podcast. Well, I have to say, for me, it's interesting to talk about World Elder Abuse Awareness Day because when the wonderful Dr. Elizabeth Podniaks from Canada thought this up and wanted to get it launched, I was really skeptical, like, do we really need another something day? And I was dead wrong. And Dr. Podniaks was exactly right on target. I mean, so I've seen it from the beginning. I don't know how many years ago it started now, but it really has launched this national movement of awareness because, as you alluded to a moment ago, Lori, if you don't know that it's a problem, you're not going to find it. And so we have to raise awareness and let people know not only that it's a problem, but it's a problem that has solutions, and that it's something that we can actually prevent, and that it's something that we can detect earlier than we have been doing and do something about. So it's been a wonderful way to raise awareness all over the world, and we're really proud at the National Center on Elder Abuse to to sort of take the lead on launching the national awareness campaigns. And we see it happening now in every state in the country. So lots of activity going on, lots of awareness raising, and providing tools, solutions, really practical information for the public.
Absolutely. You all do a great job, and this has gained a lot of traction over the years. It's really delightful to see how it's been growing. Elder Abuse Awareness Day, the activities and the awareness has been growing year after year after year. So you and the team at the National Center on Elder Abuse has been doing a great job on that. Can you tell folks a link to where to get more information about World Elder Abuse Awareness Day? We can post that on our website, and I know we link to it at the Consumer Voice's website at theconsumervoice.org.
Right, and we link to it at the National Center on Elder Abuse. So that's just the easiest thing to do is Google
Great.
National Center on Elder Abuse, and you'll get right to WEAD, as we call it, World Elder Abuse Awareness Day.
Perfect. So I know you've also done a lot of work in looking at the issue of abuse among elders. And can you talk a little bit about the prevalence of abuse? What do we know about the prevalence of abuse among elders, including in long-term care facilities?
Well, so it's shockingly common. It's estimated that about 1 in 10 older adults is abused or neglected at some point. And if you look at people who have dementing illnesses like Alzheimer's disease, the number goes up to 1 in 2. So 50% of people with a dementing illness are abused at some point during the course of their illness. It's hard to get good information about what's happening in nursing homes and other long-term care settings, because as you can imagine, researchers aren't particularly welcome into those settings to study these issues. And it's also hard to study, and because there's a lot of room for interpretation for it. But what we do know is that it's common. We know that it happens a lot at home. We believe that it happens a lot at nursing homes, and we have a lot of sort of circumstantial evidence for that related to interviews of people who work there and who have lived there. But because many of the people who live there, because let's not forget the second word in nursing home is home. These are whenever I enter into a nursing home, I'm very aware that I'm entering into somebody's home. But it's often not a very home-like environment. And the people who live there often have cognitive impairments that either makes it difficult for them to communicate what's happening, or they do communicate what's happening and we don't believe them because they do have a cognitive impairment. So it's a little hard to get a handle on what's happening. And I'm sure during the podcast, we'll talk about a few other barriers to understanding this as well.
Yes, absolutely. Go ahead,
That
Bev.
really points to the need for really good staff training in dementia to be able to recognize when someone has changed, something's going on, to start asking questions, and good education for families too. And, for many years, I've seen a perception out in the world that, if someone is having a problem at home, or maybe has an abuser living with them, or isn't able to take care of themselves, that they'll be safer if they go to a nursing home. And so I think this is a great opportunity for us to really dispel that myth that people can be abused no matter where they live. And as you said, Laura, the other contributing factors, risk factors in long-term care, and when you have insufficient staffing in those facilities, and not consistent staffing for the staff to get to know those residents and families and understand how to really provide care for them, there are so many things that can happen and go wrong.
Well, and I think, you both raised some really important points. And, certainly the people that are living in long-term care facilities, because of the conditions that often lead them to go into the facilities to live there, can cause them to be more vulnerable to abuse, and often unable to either raise issues or raise concerns, or the fact that they may be abused. And so we often rely on others to help identify, to help protect, to help, help prevent in so many ways abuse from happening. And there's a lot of reliance on staff, on family members and visitors that come in to help play some of those roles. And I think we know that sufficient staffing, both in terms of numbers and in terms of training, is a really critical element of helping to prevent abuse. Do you both see that in your work?
Yeah, and staff turnover is a problem. I'm so glad that Centers for Medicare and Medicaid Services are starting to post information about staff turnover, because again, if the staff don't know the residents and don't become a trusted person for that resident to be able to speak up to, we want staff to speak up if they see something wrong, maybe something another staff person did, or even, someone else, a visitor coming in. We need residents to be able to trust the staff. And with the continual churning of staff, you don't develop those trusting relationships. Abuse is like the ultimate form of ageism, right? That it's just, if you don't have people caring for older adults who really care about what they're doing, as the National Association of Healthcare Assistants says, we need to have a care force, and stop talking about a workforce, but really talk about a care force.
Mm-hmm.
Yeah, I love that point, Bev. And it brings into I think into the light some of the tension that exists. Are they facilities or are they homes? What is the role of a staff member? We want to avoid victim blaming because that person is so hard to take care of. Right? Not their fault. So, but the staff are under their own pressures as well, whether it's poorly paid, their own home situations, long hours, tough work, lack of training, etc. Right? But that doesn't allow or excuse any form of abusive or neglectful behavior. And then we have to go one level up and really look at the industry itself and understand that there's, occasionally you have somebody who has, let's say, some psychopathology and is doing really awful things, sexual assault, physical abuse, etc. But I think even more commonly are these systemic issues where people aren't getting paid enough, aren't getting trained well enough. And so it's easy to blame that CNA when really it's several levels above that we also have to talk about that contributes to an atmosphere in which abuse and neglect are allowed and really in some ways just almost a setup for it to happen.
Yes, absolutely. I think that that's really critical because so often it's these other factors that either lead to, as you mentioned, to some of the incidents that may occur, or prevent some of the warning signs from being identified. And so that is really critical. I mean, there are certainly requirements for facilities to have sufficient staff to ensure that they're adequately trained on abuse prevention, on reporting, requirements related to reporting, ensuring that staff are well trained to handle the needs of the residents that they're caring for, including people with dementia who have cognitive impairments. And those things are really critical. And a lot of that doesn't always happen for those individuals. And so the systemic issues absolutely need to be addressed.
And it needs to be enforced. So it's a nice thing to have regulations, but we also have federal versus state issues. So, and we have a very powerful lobby. And we absolutely, I mean, there's plenty of data showing the relationship between staffing ratios and bad outcomes for the people who live in nursing homes. Yet you have at state levels groups fighting the enforcement or just legalizing staffing ratios, and then we have to enforce it. And then when we enforce it, we have to enforce it with teeth, because frankly, I think for some places, hey, $12,000 fine, no big deal. That's the cost of doing business. but somebody was neglected to death. And is that all that a life is worth? So I think the other issue this gets to, we mentioned ageism a few minutes ago, is the dehumanization and how easy it is to think of a person living in a nursing home as other, less than human, they have Alzheimer's, whatever, and the importance of returning the respect and dignity in recognition of another person as a human being, how important that is for all of us to keep in mind.
Absolutely. And certainly, as we all have been advocating, for stronger enforcement and standards, because that is definitely a deterrent that needs to be put into place related to this, and to ensure that people are protected. And that's what the system is for. The enforcement system is to help protect people and to prevent bad outcomes from occurring for other people in the future. And so that's definitely something that we need to be advocating for. As we think about, sources of support for residents, we think a lot about the Long-Term Care Ombudsman Program. And this was, again, as I mentioned earlier, another reason why we wanted to do this podcast today, because as we were looking at recent data that ombudsmen submit to Bev, your office at the Administration for Community Living, we noticed that that physical abuse jumped into the top 5 complaints that were received by long-term care ombudsmen in 2020. And that really stuck out for us because it had not been that high in the complaints that had been received. So first of all, can you talk a little bit about what the Ombudsman Program is, and then talk about why you think this might be significant that we've seen the abuse complaints jump in to the top 5?
Well, the full Federal Older Americans Act requires that every state have an office of the state long-term care ombudsman to advocate for residents of long-term care facilities of all types. And some ombudsman programs also have state authority to do their work in home and community-based settings if someone's living at home and getting home care services, for example. But primarily, ombudsmen are known for investigating and trying to resolve complaints that are made by or on behalf of residents. We get many complaints about families or from families, excuse me, and other visitors. And so anyone can make a complaint, and ombudsmen are sometimes the ones identifying the problems. If they're able to have a regular presence in the long-term care facility and kind of see what's going on. I talked about consistent staff assignment. Similarly, we want ombudsmen to get to know facilities and get to know residents. And but they also do some systems advocacy, representing the interests of residents before governmental agencies, testifying on legislation, and so on. And I know that there have been some bills recently or over the years, but I think we've heard about it more recently with the pandemic and lack of visitation or restricted visitation, that people have wanted to put cameras in rooms. So that's been a point of legislation in some states as well. So you're right, that abuse did join the top 5 ombudsman complaints, both in 2020 and 2021 in all types of facilities. But it's, it went up both in assisted living facilities as well as nursing homes. And, we were talking about enforcement, and there is a federal role in nursing homes for enforcement of quality standards, but we don't have a federal role in assisted living. And so people really need to get to know what their state requirements are and how regulators see assisted living and other types of facilities. So one thing I wanted to point out, I'm not a statistician, but I do think it's significant that overall, over the last couple of years, total complaints to the Ombudsman Program have gone down, but abuse still went up. And so I think that is especially significant. During the pandemic, early on, we had, with the visitation restrictions, and visitation went into the top 5 in 2021, as well as restrictions were lifted and people could go in according to the regulators and Centers for Disease Control and Prevention. However, facilities weren't following that and opening up as much as families wanted. And so our visitation complaints went up. But so early in the pandemic, people were calling and saying, I can't get in to see my mom, and, various things happening, maybe window visits they were doing, that sort of thing. But then as families started going back, the stories we heard about what condition that they found residents in, weight loss, lack of mobility, now using a wheelchair all the time. Mom used to walk down to the dining room. Now she's not walking. Poor personal hygiene, those sorts of things that families saw after they hadn't been in homes for a long time. And so I think that is part of the increase in abuse complaints, that families just saw things that maybe they had missed because of the pandemic, and because they weren't in there, and there weren't very many eyes and ears in long-term care facilities, sadly, in the early stages of the pandemic, to see what was going on. And it's just not a good situation.
Mm-hmm.
And if I can tag team on that, Lori, I can't imagine one other group of people in this country who you could have put into solitary confinement for such a long period of time,
Right.
and get away with it.
Right.
I think it was reprehensible, and I think it was disgusting. The ombudsmen were kept out. Family members were kept out. Residents were not asked about their opinions. Their autonomy was completely subsumed by whatever the corporations wanted. Now, I can understand that the first few weeks, or maybe even the first few months, maybe. But after that, no, not acceptable. And again, no consequences.
Mm-hmm.
So even when, I think after a year it took for the government to say this is unacceptable, there were still no consequences for places that were keeping families out, ombudsmen out. And then it was disingenuous. Like, well, if you want to come in, you have to test negative, but there was no access to tests in order to test negative.
Mm-hmm.
So we have to learn from that, and we have to do better.
Mm-hmm.
This is not who we want to be as a society. We talk about ageism, which is really just a bizarre prejudice against our future selves. And people need to understand deeply that this is us, this is our loved ones, and this is us. And it did not show off our best.
Absolutely. I think that's absolutely right. And hopefully we will have learned from some of the things that had happened. Although I think we have a lot more work to do in order to ensure that we don't have these things reoccur again, particularly as we see numbers rising in certain parts of the country. We're starting to get reports again. I
just want to say one other thing, in fairness also, right? So here I was going into COVID wards fully gowned. I was with as a volunteer long-term care ombudsman, I was with my incredible supervisor, Rachel Tate. And we would go in fully gown gloved, all that sort of stuff, seeing people. And then I saw also what the staff was up against, right?
That's right.
So I could be in the hospital setting or in our outpatient clinic setting where we had all the equipment that we needed. And then I'd go into the nursing homes and they'd be out of gloves. So I do want to I want us to understand that they were very, very under-resourced as well.
Yes.
And that has to be fixed. Still no excuse for how we treated the people who live there.
Yes.
Well, and when you're talking about personal protective equipment, it takes a long time to properly put on and take off personal protective equipment. So nurses going from one unit to a non-COVID unit to a COVID unit to administer medications, then medications were late because of the extra time that took. So, we've always said that we didn't have enough staff in long-term care. And so during a pandemic, you really need more staff. You need to add staff because of some of these other factors going on, and you need to be able to cohort or have those staff assigned to the COVID unit so they're not going back and forth, and it just didn't happen. And the federal government provided resources, provided money to long-term care facilities, but I don't know that we have a good handle on how that money was used. Was it used to hire new staff and bring on and increase the pay for staff? So there's this accountability problem too.
Mm-hmm. Well, and so many of the factors that we're talking about today did really lead to this perfect storm where vulnerable people were really at higher risk for abuse in terms of some of the systemic issues that we talked about a little bit earlier, some of the stresses that were put on people living and working in facilities or visiting facilities. And so there are a lot of factors which could explain why we are seeing the increase in abuse complaints, particularly to ombudsmen. So as we think about, the issues related to abuse of individuals, and as people are listening and wanting to know, what are some of the warning signs of abuse? So Dr. Mosqueda, could you talk to us a little bit about that? What are some of the things that, people should be looking out for, whether they're an ombudsman or a family member that could say, hey, something's not right here?
Yeah, so there's a variety of things. I mean, one is just listen. We have to listen to people, and we're not very good at that. And I really include my physician colleagues in this. We haven't really talked about medical staff. We've talked about CNAs, but what role do physicians have in understanding this? What role do we have in doing a better job of caring for our patients who live in long-term care, in looking at their medications very carefully, working with some of the wonderful pharmacists who are there, and making sure that we're not imposing chemical restraints on people. And how are we empowering our patients by asking them how they're doing and asking very direct questions. So the first thing we have to do is listen to what people are saying. The next thing we have to do is observe. And I have a golden rule, particularly for people who have a demanding illness, which is any sudden change in behavior is a medical problem until proven otherwise. And on what we call the differential diagnosis, and differential diagnosis is just like a list of things. So if you go into the doctor and you have chest pain, we have this list of things it could be, right? Anything from pneumonia to a heart attack to inflammation, to a whole variety of things. That's our differential diagnosis. We have to have a good differential diagnosis when somebody has a change in behavior. And on that differential diagnosis is abuse or neglect. That's one of the possible reasons somebody is having a change in behavior. So we have to observe and look for it and ask questions. We also have to observe for physical injuries. Hey, older people bruise easily. Older people get pressure sores. And for not one minute do I think that every pressure sore is a sign of abuse or neglect. I think they can happen despite adequate care. They can also happen because somebody's getting neglected, and sometimes neglected to death. And what we know with this neglect is it doesn't, just happen for days or weeks. It happens for months or years. So we really have to be alert to physical evidence. There's also laboratory evidence that we can look at. So the long-term care ombudsman can call in help if they need interpretation of laboratory data that might look at weight loss trends or inadequate response to nutritional status markers that you can find in blood tests when you look at things like the interdisciplinary team notes. Inadequate documentation on the part of the physician. They clearly aren't even aware that this person is going downhill. And this over attribution to, well, they're old, well, they have dementia, what do you expect? Oh, well, I expect a dignified life, in recognition that this is a fellow human being who we're going to care for. So listen, observe, and ask questions. How are things going? Open-ended questions. And I know as a physician, I'm not asking a question with my hand on the doorknob. How are you doing? It has to be sitting down with that person, recognizing their humanness, eye to eye. How are things going for you? And asking those questions in a way that I think that that person knows that the only reason you exist at that moment is for them. And if people feel that and understand that, they'll tell you sometimes bad things that are going on. Yeah, Bev, what do you think?
Yeah, Laura, you raised a really good point. We haven't really talked about the role of the medical director in a nursing home, and even in assisted living for some that have them. But, you know, I don't think that medical directors are included enough in, you know, quality assurance, performance improvement activities in the facility. They really need to be the people who are saying, you know, these are the general conditions of residents here, and they should contribute to how many staff that home needs to have, and be working alongside the administrator and the nursing staff to help run the place. I mean, director means something, medical director. And so I think maybe some more emphasis on the role is important. And, you know, we've talked about abuse complaints in the Ombudsman program, and I want to also point out that although not in the top 5, gross neglect complaints also have increased or have risen in the top complaints, went from something like 25th, 26th to now closer to maybe 18th, something like that. In the more recent years. And, you know, there are specific definitions for abuse and neglect, and usually they involve the word willful. But there are a lot of other things that happen. You know, symptoms unattended is a complaint that's been in the top 10 that ombudsman programs have reported for years. And so that's still kind of a neglectful activity, you know, not paying attention, not noticing that, you know, there's a redness on, you know, where the hip bone is because the person hasn't been out of bed or hasn't moved around in the chair, they're using wheelchairs for seats instead of transportation, and people aren't moving back and forth, and they're getting those pressure wounds. That, you know, symptoms unattended, you know, that's the same thing. You know, that it means knowing something's there and not doing anything about it.
Absolutely. And you both raise very good points, you know, with respect to needing to include the medical care, the medical director as a key part of the team who's, you know, really paying attention to what's happening in these long-term care facilities. And I really like your listen, observe, and ask questions steps for looking at and trying to engage with people, try to identify what's been happening. As you know, so many people living in long-term care facilities have cognitive impairment or dementia. And so, you know, how is that nuanced when you're talking about, you know, the listen, observe, and ask questions?
Well, I think that the first thing I do is believe the person until proven otherwise. And I find that sometimes I have colleagues who do the opposite. Well, they have Alzheimer's disease, so it gets dismissed. But the first thing to do is to believe the person and investigate and find out what is going on. I think the other thing is that particularly for people with dementia, you want to find them at the best time of day. Many people have issues like sundowning, or they're more agitated in the morning or more confused in the morning when they just get up, like most of us are. And so it is our job is to find the person when they're at their best, when their pain is best controlled, when their cognition is at its optimal, and to have the conversation at that point. I think it's very important to get medical personnel involved who can do a physical exam, so that if there is a question, that you are looking at all parts of their body. So, and not over accepting, well, they're old and they're on a blood thinner. Yeah, but how you still have to have some traumatic event to break a blood vessel and to cause bleeding, except under rare circumstances. So, I just, Sherlock Holmes was based on a physician, because we're supposed to be good detectives and put all sorts of things together. I think long-term care ombudsmen are Sherlock Holmes as well. Mm-hmm. So does it make sense? Does it make sense that somebody who's non-ambulatory has bruising on the bottom of their feet? Does it make sense that somebody who's supposed to be up and moving around has a stage 4 pressure sore on their buttocks? Asking questions and not overly accepting of why somebody has a fracture, I think are very important questions and observations that we need to make. And then, interviewing staff as well to understand what's going on. And sometimes it involves talking to the roommates, talking to other people who were there, and seeing who knows what.
Mm-hmm.
Yeah, and if someone is acting differently than they normally do, seems upset about something, to really kind of dig in and do an investigation and find out why. Just keep asking why. And it could be, you talk to the caregiver that day, and say, how was she when you arrived this morning? And she might say, well, she was out of bed earlier than normal. Usually I help her get up in the morning and help her brush her teeth, get ready for breakfast, but she was already up this morning and she just doesn't seem right today. And so, but I don't, or, a different nurse aide say, well, I don't normally take care of her, so I don't know. Well, where is the person who normally takes care of her? Could we give them a call? Could we have them come over and see her and just kind of, let's figure out what happened this morning that's different, and then just keep digging in to see, what might have happened and what might she be upset about that she can't verbalize to us. And that's another way of listening. Some people just can't give us the words, and we need to stick with it and spend some time. And that's what we tell ombudsmen too, especially new ombudsmen who might not be used to working with people with dementia. Just sit with them. Mm-hmm. Just sit. If they talk about the birds, talk about birds. If they talk about food, talk about food. Get to know them, sit with them, something will be revealed.
Mm-hmm. Absolutely. So, as we think about the investigation, the asking questions, which is absolutely really critical. We always recommend that residents and families who have concerns reach out for help. Certainly within the facility itself, talk to a trusted staff member, go up the chain of command if there are concerns, social worker or, directors of nursing or administrator, try to find someone to provide help. Reach out to the ombudsman if you need assistance as well. What kind of support, Bev, can ombudsmen provide for residents and families?
I think that familiarity with the facility is key, that, an ombudsman might know that this particular nurse is a person who has some expertise or in whatever the subject matter is, or no, for this particular problem, you might want to talk to the dietitian, because I know that dietitian and I know that they're very involved in care planning. And so the ombudsman's knowledge of how those facilities kind of operate can give people good tips. And then also just giving families advice about things like I just mentioned, just sit, just spend some time with your mom, ask some questions, identify for the staff how you took care of your mom when she was at home. Make sure that the staff know your mom or your dad's idiosyncrasies. Is this something that they've always been like throughout their life, or is there a change? So speak up, the kinds of things to notice and so on. Those are great reasons to call an ombudsman, to kind of walk through those problems. And ombudsmen like to empower people to handle problems themselves. But then if it doesn't work out, we are here to get involved and do some of that investigation, look at records, talk with other residents. That might be something that family members wouldn't do, is, walk up and down the hall and talk to other people and find out if something similar is happening. But ombudsmen do that. They might get a complaint about an outing being canceled. And so they want to talk to other residents and find out, how much of a problem is this? Is it just this one incident for this one resident? Or they can find out, is this a trend in this home, and find out why that's happening. And there's also strength in numbers, right? The Consumer Voice has a great family council resource called Strength in Numbers. And there's a lot of value in that, and ombudsmen can should be assisting. The federal law requires them to assist with development of citizen organizations and development and making resident and family councils stronger, so they can be a resource there as well.
Absolutely. Well, I certainly think, one of the things that, as we've talked about today, if there are concerns, changes in condition, if you see red flags that cause you to be concerned, you need to speak up, whether you're a resident, a family member, an ombudsman, anyone else. Don't be complacent, but speak up and certainly begin asking questions. Get to the investigators. Some of the investigators include requiring investigation within the facility. The state departments of health and licensing agencies are places where you can file complaints, and they're required to do investigations. Contact the ombudsman for assistance, but don't just let it go. If you have concerns, I think the important thing is to raise questions and start that process of trying to get to the bottom of what happened. That's a way to not only prevent abuse, but to help someone who's been victimized by abuse.
Yeah, that's a really good point about the regulatory agency, Lori. I'm sorry I left that off, but an ombudsman can assist too with the right words, the right language. They know the regulations well. They're not the regulators, but they know the regulation. We had an ombudsman in my former state that said, we provide the tools and the rules. And so the ombudsman know what language. We had some data in that state, in fact, that we would check with the survey agency, and they substantiated at a higher rate complaints made by the ombudsman compared with the general public. So an ombudsman can help the family craft that complaint to the survey agency, or maybe just submit the complaint themselves on behalf of the family or the resident, to help the surveyors see the right things to be able to enforce the regulations.
Great. Well, go ahead.
I was going to say, not to be the skunk at the picnic on this one, but even at the regulation level, at state levels, we're not doing a good enough job.
Yeah.
We're not responding well enough. I think the agencies need more funding, and I think with what they do have, they're not doing well enough in general to respond to these sorts of complaints. And I just want to say one thing about prevention, because we've talked a lot about abuse, but there's so much we can do to empower residents, empower families, the people who work at nursing homes, that we provide better structures for people, tools. There's a wonderful program called Time Slips that is all about unleashing the creativity and imagination of people with dementia, and that's an example of a practical tool that can be provided to staff at nursing homes and family members to help engage people. So there's things that we can do that elevate how we work with each other and how we treat each other, so that it's done with warmth and love, as we're caring caring for those who cared for us.
And I think that that's a really great way to end the discussion for today, which, really is focused on, the goal is to ensure that that we are taking care of each other, and that we're doing the best we can to prevent bad things from happening to each other, and ensuring that people are getting not only the care that they need, but able to live their best lives. And so I think that's really what we're focused on. And certainly I think we've got a number of good strategies that we've talked about today to help people not only think through prevention, think through how to, best work if you see concerns and respond to situations. But I think we've also recognized that there's a lot more advocacy that we all need to be doing to improve the systems that we have in place in order to better serve the people that are receiving services. So that's something, looks like we've got our job still cut out for us, right, to be moving forward with. So you can get more information about all of the things that we talked about today on the Consumer Voices website at www.theconsumervoice.org. And also want to say it, the National Center on Elder Abuse has some great resources on abuse and neglect, and a lot of different issues that relate to that, that are can be used by family members, by advocates, by professionals and others. And the Administration for Community Living, which funds both the National Center on Elder Abuse and the Ombudsman Resource Center that the Consumer Voice houses, has also some terrific information on their website as well that we can be looking at. So we link to all of those from the Consumer Voices website. I would like to thank both of you, Beverley Laubert and Laura Mosqueda, for joining me today on today's podcast for really interesting and engaging discussion on this issue, and look forward to talking to you both again and working with you to continue moving these issues forward.
Thanks
So
so much.
thank you so much.
A lot of fun.
Pursuing Quality Long-Term Care is a program of the Avoiding Drugs as Chemical Restraints Consumer Education Campaign, a partnership of the National Consumer Voice for Quality Long-Term Care and AARP Foundation. Make sure to visit our website, theconsumervoice.org/pursuingquality, where you can share your story with us, subscribe to the podcast, and find more information about the campaign. If you enjoy the podcast, please rate, review, and subscribe. Thank you for listening, and we'll see you next episode.